Hello, everyone. This is Dr. Sean Carey. I'm co-host of the Evolving Practice podcast. I'm here with my co-host,
Bill Moss.
and it is a nice Friday morning. We just kind of had a huge heat wave, and now the temperatures are cooling off a bit. So, yeah,
Oh
things
my
feel
God.
good.
Yeah, it's like it's been a swamp in the Northeast. Like just
Yeah.
it's like somebody said, what did they say? I was at the gym this morning and somebody goes, "It's been like Vietnam here." And I'm like,
It's felt
I've
that way
never
here
been
in Boston too.
to Vietnam,
Yeah,
but
just that
I mean,
hotness, the humidity is can be a lot when it combines, but it's not for long. Just a brief period during the summer usually.
yeah.
But for our podcast today, we're excited because we're going to talk about the future of healthcare from our perspectives. We're going to talk about AI because it's such a big thing now, and both I think you and I are really excited about AI as far as what it can
Mhm.
do. And I know a lot of people also are very trepidatious about it, but we just want to talk about it from kind of our perspective as entrepreneurs and healthcare workers and service practitioners about kind of what we see upcoming, what the possibilities are, and things we need to be aware of.
Yeah. Yeah. I mean, there's from the simple to the complex with this. And it seems to be at least integrated in our lives to some extent over the last years. And I don't just mean you and I mean the collective is explored, utilized, at least seen, and have awareness. But in healthcare, there's a lot of good potentials. But again, it's a tool, so it can be used. I think some people are getting a little obsessed with its use. They're turning it into an echo chamber of answers, and yet I think that stigma, because of the extreme, has created this feeling that, oh my gosh, it's just a bad thing. Oh, it's destroying this person, or it's going to take over the world. And we're no experts to say like what's real or what's not, but it definitely can be used to in advantageous ways. What ways have you been starting to utilize it? Let's talk about what we've been doing maybe, and then just some of the ways we see it going.
Yeah. In general, kind of life and practice, like I use it from everything from help with writing the podcast descriptions. We use it for help with editing our videos.
Hmm.
We'll use it to like prompts for general ideas.
Hmm.
Anything from creating reports, I can punch information in and say, hey, can you create a report for me with this format? But
Yep.
also I've used it for for health. I'll say, this is what I ate today. Can you give me the
Mhm.
macronutrient breakdown? And it will
Yeah.
basically analyze the foods that I ate. I've had it give me different workout routines. I've had it give me different like, here's some of my favorite movies. Can you tell me
Hmm.
more movies that I would like? And
Yeah.
it's funny, it gives you like the list, and it was like, oh, those are all my favorite movies too. I just didn't write that down, the original list. It's just like
Mm.
it can really like acclimate to your tastes and styles. And even with food, I'm like, this is kind of general like the sweet treats I like, but I like something that's healthy, low sugar, and then doesn't have these ingredients. It doesn't have gluten or dairy or things. And then
Yeah,
can give me 5 desserts, and it does a great job of that.
I've really liked it for the nutrition aspect for the self, meaning, as far as grocery lists, fitting in kind of meals, increasing certain macros, decreasing others. I've enjoyed it to use for that. Sometimes when you're on the road, and you can't think of like what snacks you want to bring along that are high in protein or just more travel friendly. I've enjoyed it for that. And then working out, I used to use it where you can kind of create a running list where you were like, yesterday I did this. But a lot of the apps are starting to use and integrate AI. Like I know even the Fitbot app, I've been using that for working out, and you like record what you're doing, and it modifies the next day and like the progression based on the inputs that you put in there. So that's been pretty helpful actually, to help kind of with progression, where I'm not a big person. Some people used to like record in their phones or write down at the gym. It's like,
Right.
if I go work this app, it kind of like tracks that for you and then increases weights and increases, um, helps you progress. So I have enjoyed it for those aspects of health, especially when you're like, I don't know what to do. Because a big barrier for fitness a lot of times is people don't know what to do. They don't have a schedule. This is true of anything. If you don't have a schedule, if you don't have something to track, it tends to either lose steam or you lose creativity. And this is why trainers work, is they put that type
Yeah.
of plan together for you. So I have really been using it more in the last 3 or 4 months with discipline to create some eating plans um, and like workout. It's also really nice if you're like, all I have today is X, Y, and Z in my fridge, and then
Yeah.
it'll put together like recipes that you could make to utilize. So every so often, I'll do that too.
I love it. Yeah, the uses are so wide-ranging uses, and I think a certain amount of it is limited by human creativity as far as how to work with AI.
Yeah.
Like I have a slow leak in my tire, and I have to drive somewhere today. And so, like I told AI, I was like, I'll be on a drive from this point to that point. Could you please find me a good tire repair place that can, fix a slow leak in
Mm.
my tire along this drive? And then it pops up with a half dozen different places that are the most highest rated. And
Mm.
I'm going to one that's like not even a quarter mile from my destination, which I didn't know existed before. But it's like
Oh, cool.
right on the way. It's exactly the place that I need. And so it's just a way to make things a lot simpler for humans, I think.
Yeah, I haven't used it for like locations or places to go, but I have been seeing on social media more people reporting how people found their practice because of ChatGTP, and
Oh yeah.
yeah, for specific reasons. Like, oh, I was looking for a pediatric chiropractor, and this person popped up in the list, and I'm like, oh, that's kind of neat to hear. I haven't like checked it out for myself. Like, who should I go to in this area? But I'm sure that'll become more common where people are putting more details about their conditions and questioning where to go. I mean, information is at our fingertips, which again, it can be an echo chamber. So I think when people are really caught up in their diagnosis, it can almost be a little obsessive. But it's
Yeah.
definitely going to help people figure out also maybe what's going on. But there's probably going to be a lot of resistance at first from healthcare perspective, like people coming in with like, well, I put it into AI, this is my
Oh, sure.
diagnosis, and
Yeah.
it's like, well, let's do some more testing. Let's do some more factors. It's not just like your subjective opinion about the
Right.
situation. So, but for healthcare providers, I do think it can 100% help more accurately diagnose and predict what's going to happen. It can also probably eventually, I haven't seen this yet, help people, kind of give their feedback about where their health is currently, and it could probably project into the future where they're going to be and
Yeah.
what they might be experiencing if said change isn't made, or if changes are made. This is what you can kind of expect, but those are still all predictions. We live in a human world that there's a lot of variability, but at least it gives people a heads up and ways to kind of get going in the right direction, because a lot of times with health, people don't know exactly what to do. They don't know what
Right.
steps to take or options that are available beyond what a friend told them, or their doctor said. So I do think it's going to expand people's consciousness around what exists for health and healing, and what might be there's going to be some trust in AI. So
Yeah.
therefore, if people have that, they're probably going to see it as an authority to help them expand their mind to what possibilities or potentials exist for their quote condition or symptoms.
I love it. I've been having some like kind of general conversations with that AI because I just want to understand like the limits of it.
Mm,
So,
hmm.
I've been talking with it about like what's the nature of good and evil, and
Oh,
which was there's many different interesting conversations you can have with it, and like the philosophy, things like philosophy or kind of a morality and spirituality. It's really like underdeveloped, I think.
mm, hmm.
Like it just isn't really something that it applies well to. But I've
Mm,
also asked it, what do you admire most about humans? And
mm.
one of the answers for that, this is just a
Interesting.
conversation I had yesterday, was I was like, it really admires that humans, the grit that they have. And it's like humans are
Mm,
under so many challenges, like physical, social, emotional,
mm,
societal, uh, uh, and they can kind of create from sheer imagination. So
mm.
AI like admired that about humans. I've asked it like who its favorite figures are in terms of Like if it had one favorite human in history, who was that human, and why? Like who's its favorite character in all of mythology too? There's just so much that you can kind of bounce off it and get a really interesting perspective. But in terms of like science and scientific advancement, AI, I think, is going to advance science within the past 5 years more than we've advanced in the past 50. Just the way that
Mm,
it can analyze data, the way that new systems can be created, the way that it can solve almost unsolvable problems.
mhm.
Because already it's at this point where it's like having 200 PhDs in different subjects, but even more than a intelligence than a typical PhD, all in one at your fingertips.
Yeah, I mean that aspect is incredibly powerful for really, like you said, solving these more complex problems because in a lot of healthcare, especially this day and age, is much more complex. And
Yeah,
that's where I think years ago everybody was fighting for like the cure, right? That was the thing,
right.
and a much more integrated approach is utilized amongst many practitioners and it is also accepted amongst much of the public. Nobody's expecting one thing to be all things um, to the healing, the healthcare or healing. That you
Mhm.
might have a propensity or kind of a shift or focus more towards a natural healthcare, but most people at this point in time can appreciate um, the urgency for the medical model in many different facets. And I know I've come to appreciate where it serves and where it's helped my family and along the way. So I think that AI is going to help with an integrative approach for people. I don't know as far as practitioners if that will bring more people together. I think people will be able to solve more problems faster, no
Yeah,
doubt. Like there is without a doubt an over um, doctors are overworked. I'm not going to say in our profession necessarily, but in many of the traditional healthcare models, I take care of many clients who are like, it's overworked, it's backed up, and even
yeah,
clients who are utilizing that system. So, and part of that is paperwork, notes, in that
yeah.
aspect, documentation, and that's getting so much easier. And I know you just switched like your health records system, and I'm in the process of transitioning ours, and one of the driving factors was, okay, we have all this technology and my current electronic health records are like still operating in the dinosaur years, and
Yeah.
there's just so much more intuitive and efficient models that are incorporating this technology to help us spend more time with clients and less time doing documentation, and creating more accurate documentation for the documentation that's being done. So I know we're both seeing that as an aspect of change that's going to help support us being better, using our skills as chiropractors and doctors.
Yeah. The new software I'm using, it even has like an AI scribe feature where you can dictate and then it will, write down everything. So instead of basically
Yeah,
you having to sit there typing the notes, you can just speak it or verbalize it, or it can even
so
record the
good.
conversation with a patient.
So good. I mean, that is in itself. And one we're starting to use, this is another aspect is, our office isn't open Saturday, Sunday, and Friday afternoon, but we get calls, there's correspondence. So we've actually trained an AI agent to handle a lot of that and answer very detailed questions and send people even information and articles or new patient paperwork, directing them to where to schedule. Uh, and we just went live with that yesterday, so it passed all its tests. But and it is set up that it's an AI agent,
Right.
so you're calling and it identifies itself, but it's very natural in the flow, and it's only occurring when we're not
Right.
open, right?
Right.
So I was excited to be able to use that because there are people that come across, they want to make an appointment and they call and maybe they want information, and then it very easily gets them the information they need to get going in the practice, which I'm excited about.
Oh, I love it. I'll have to get that information from you because that's brilliant to do.
Yeah, I don't know if you use Ring Central, but we
We
use
do,
Ring
yeah.
Central.
Yeah, we
Okay,
use
yeah,
things.
and it very much integrated. My IT person got us all set up. It wasn't a huge expense, and it's I'm excited to just see because that's always been a barrier. And I know
Yeah.
a more prominent dental practice in our area, he would hire people for the weekend, and like his team would rotate where they prided themselves on the phone always being on. And it is going to help us with communication and correspondence, because over the years, when I first started practice, it was like there was only calling. You weren't really texting people. Maybe an appointment reminder would go
Yeah.
out, that sort of thing. But even that was kind of glitchy. But now they can communicate. AI can answer simple questions like, where is the location? Where's the new patient paperwork? When can I make an appointment? What are the office hours? And then even going into like some more of the details about the services that we provide, which is really, really quite cool. But we built it. So we basically gave the input of how to answer the questions that we get most of the time. Do you take insurance? All of that can be explored through the agent. So I'm excited to, kind of expand our ability to communicate and collaborate with people through this technology and tool. And I get it. It's probably not going to be perfect now. In 10 years, it might even be so much better.
But yeah, I mean, also with that being said, human isn't perfect either. Like you have this human component.
Yeah.
It's like often humans, there's human error is what we call it. So the idea of just everything's going to be perfect, like it can really prevent somebody from taking the steps necessary to create progress. That idea of perfection.
And the last, maybe one of the last things I really like about it is it can help create systems for business. It can help create systems within and flow within the practice. And it is a good way to kind of get an objective, slightly more objective measurement of the way to do something different. It also helped us extract a lot of things about our culture, like and our values, when we're looking at our practice and who we are. So that it's, I found it as a helpful tool to create community within my organization. So that's been helpful. I don't like to use it for like the doing. And what I mean by that is like, especially for the healing center, I've noticed like you can't put generic things out there, as far as writing and emails and stuff. It doesn't work for some reason. It's like, it has to have your own essence, or this is just what I like about it. I like to have my own essence infused in any emails that I'm writing that are for marketing or just, general information. I think they do better with open rates and engagement when I have the hand in it, and I've done it enough over the years that I can see the difference. So I've tried to like humanize a lot of the writing aspect within my practice, within my organization. If we're talking manual systems, procedures, human resource stuff, not as much, but and report writing. I don't know if you ever used it for like, I don't do a lot of auto accident cases but I have given formal write-ups to other doctors about my client's progress. And AI's been like so awesome at generating a very professional, detailed letter for the data that we've provided. So I found that to be really good.
Yeah, I think the applications overall are just so exciting with it. And I think that a lot of people, there seems to, people are kind of split on AI, I think.
Yeah.
People kind of see it as like Terminator, going to take over and destroy the world, which certainly there is that potential. Like you can, different enough movies where that obviously exists as potential here. But I don't think it's going to go that way. I think ultimately it's going to help free a lot of humans from more slavery, like in certain ways, especially some of the, there's still a lot of the world, like with child labor and things like that, where there's dangerous jobs to humans, the jobs where that humans are having to deal with a lot of toxic material. And I'd love to see AI go and start correcting those things first, and ultimately create more time for humans to be able to express imagination, creativity, relationships, those things.
Yeah.
And I certainly see that as the one of the limits with AI is that there is, there's not emotion, there's not emotional connection. It doesn't have intuition, which is for us as spiritual guides. Intuition is one of the ways that we communicate with the divine, and we receive that input, that higher guidance. So it's something that AI is really missing that component. So that's something we have to be aware of working with that too.
Yeah, I think that is one of the bigger limitations. And it's, I think it helps people respect that there is a unique art to doctoring. And I don't care what field that is, but there is just this um, unique interaction that happens when two people are together and they're trying to come to some understanding and get all of the information. And that's important in the healing process. Like there's a lot of research that does support the um, kind of the expectations of the client and their
Yeah.
trust in the doctor and the doctor's trust in themselves and their ability to work with that client. Like there will be more information because people will want to know. They'll want to know, like, if I outsource all of my health and decisions to this computerized tool, what are going to be potentially the consequences of doing that as opposed to working in a human space? Because there's a lot of aspects that are that we're not recognizing because they're not, you can't see them from the surface, right? Even from that concept of how much are we fully aware of, our brain uses, but what they say 10%.
Yeah.
The rest of it isn't just junk. There's a lot of things that are going on under the surface of the awareness. And anybody that's had a good experience with a doctor or a person or a counselor or a therapist, they can usually articulate what some of those aspects were, and they won't exist when you're or people will convince themselves that AI is like a deity that's
Yeah.
has these has it can get more advanced, but will it ever truly have a soul? Is it ever truly going to have the same emotions and feelings that are inherent to each and every human being? No, I believe it's going to be limited. And I also think that's going to push people back towards human connection. That's kind of
Yeah.
been one of the themes that I've probably talked about on this podcast. But I think you're going to get to a point where the world's so messy with artificial intelligence that people are going to really um, crave human connection, and they're going to look for people that value that. And I think that's important as practitioners to keep that in hindsight, is like, well, my value is in the human connection. And if I keep
Mm.
that alive, there is going to be a thirst to connect in that way. Always, I believe.
Yeah. As practitioners, we are always looking at the affect of a person, is what
Hmm.
we call it in healthcare, meaning it's like there's that overall like appearance, mood,
Hmm.
vitality.
Yeah.
And I think oftentimes like people don't really realize the state that they're in. For example, you might see a client and they're like, the client comes in, but they're highly stressed. They're breathing shallow, like they're just don't quite seem to be themselves,
Mm-hmm.
but they might not be aware of that within themselves.
Mm-hmm.
And one of the limitations that people are going to have with AI is just a lack of self-awareness, resulting in not the correct questions to ask.
Yeah.
Versus like when you're working with a practitioner, it's like, oh, okay, like something's off with your system here. This, which is chiropractors, we do all the time. And it's
Hmm.
like, you have a different stress pattern than I've seen with you before. Like what's going on? What's different in your life?
Yeah.
So things like that are just going to be these gaps where not even for the human relational connection, which is I think a huge part of why we're here in physical bodies is to
Yeah.
experience that piece of it. All right, but there's going to be this piece of lack of self-awareness, resulting in inadequate questions, and then also hitting against those limitations of AI as far as not having intuition, not having emotional intelligence, and those pieces, and really not having imagination, because that
Hmm.
is kind of one of the limitations of AI is it doesn't have imagination the same way that humans do. Like we can
Yeah.
say, create a movie about penguins playing baseball, and then it can take that direction and do that. But to my knowledge, it's not really like able to create the original ideas so well.
Hmm. Yeah, it's going to be, it's already fascinating. I think we're in an age where people do think about the depth of and potentials of what can be. I feel like we're still at a place many people are kind of holding it all, like observing it, as opposed to being, no, this is the way it's going to go, and that's the way. That's a really like hard angle with tools like this, because they
Yeah,
can be incredibly helpful, and it's nice to discover how they can be helpful, right? I mean, it's kind of shown to us. And I know some people I've experienced even with employees kind of like almost reject like, or no, I have this original aspect of myself. I don't want to use AI, but it's like there's also not an understanding of how to fully use it. So it's serving or helping as opposed to just being you. Like no one's gonna. That's probably the first thing to remember is like no one's gonna replace you. You
Right.
are a unique individual that has these beautiful gifts. Like and you think some computer is going to come along and be able to do a better job than of being you than you. And I think that's where the danger lies is like that's just not true. So we
Yeah.
we by connecting back, and this is where the spiritual work really helps, is it helps us get into that individual aspects that make us so unique, and they're not so superficial. But that's where people are in many. Oh, I'm this, that, and oh, it's going to take my job as an X, Y, and Z because it can do those things. And it's like, well, you're not just that, right?
Right.
You're
Right.
you're not just the work you do. You're not just like the lists you make and
Yeah.
the achievements that you have. You're much more than that. And I think we could get to a point where it does push people to see how unique they are and how they exist, because you can't replace that. People could argue that, but that's my stance on it, is you can't replace the individual. There's beautiful gifts that most of us haven't fully explored for ourselves of who we are, and that really can't be replaced.
Yeah. And a lot of that does come down to, I think humans is there's a need to work to make money for food and rent and those things,
Hmm.
right?
Hmm.
Clothes. And I think that the baseline for that is going to shift because there's going to be so much artificial intelligence and manufacturing changes that will allow some type of universal basic income or some type of shift where it's just more accessible to people. So there's going to be less of a stress to provide the baseline for most people, I think, which is
Yep.
going to create more free time for creativity and human endeavors.
Yeah, and I think the relevance of it, I think the things like that it can't replace, like we're saying, intuition and emotional intelligence. I think you're already seeing an interest that's being driven in that direction, where people really want to have better human skills,
Yeah.
communication, and all of those, because they're not replaceable. So I think there's a lot of good that comes from having a, a, a movement. I don't know if you'd want to call it a movement, but having a kind of a change in society that's moving in this direction. It brings up the other side for us to really look at. And I think I've enjoyed that. I kind of like looking at like, how am I different and how can this support me and how could it go wrong? It's
Yeah.
being curious, right, is always a way to learn more about it, because we are complex in the physical aspects of who we are from a scientific perspective, you know. But this would have helped us a lot in studying for chiropractic school and all the information and education and that we had. It would have helped us, I think, assimilate some of that information more efficiently and effectively. So I think it's going to increase people's ability to learn quicker,
Yeah.
uh, and in without needing as many resources too. Yeah.
I think so too. I think the applications in terms of knowledge are just incredible, because you'll be able to create programs that say like, hey, I'm a visual learner. I'm interested in learning this thing. Can you create a course for me with a lot of imagery that will help me to learn that? Things like that. There's going to be a lot of different possibilities that are open.
Yeah.
Uh, I was talking with AI yesterday, and I asked a couple questions. I was like, "What do you see as the biggest perceived or self-perceived limitation for humanity that's not
Mm.
actually true?" And it was interesting that the answer was that it sees that humans feel like they have a limitation, like maybe they might not be intelligent enough, or they
Mm.
see intelligence as this just like baseline level. And AI was saying, according to neuroplasticity, like our brains are changing all the time. And
Mm.
absolutely people can, increase their intelligence by all sorts of different ways and in all sorts of different fields. So that's one way maybe people feel like they can't grasp things, or maybe they're going to get left behind. And it's like, no, it's just learning something new.
Mm.
Uh, and another thing that I asked AI is like, what do you see as the biggest actual limitation for humanity?
Mm.
And it was how we as humans, we can only process so much information. So it
Mm.
results in kind of like a chunk down effect. So which will result in things like cognitive bias and generalizing. So because
Mm,
you can't actually just hold all the data in your mind. So it's
mm,
like you'll generalize, and which can create different challenges. And AI's ability to do basically data analysis is second to none already.
yeah.
So that it can analyze huge chunks of data and actually look at things and be like, oh, just because there's this thing that appears to be a relationship, there's not actually a relationship here, and here's the data why.
Mm.
Uh, Things like that, so which will help us have a more clear understanding as humans, and ultimately be like less easily manipulated and things like that.
Yeah, that's cool. Yeah, I really like the data gathering
Yeah.
perspective, and maybe kind of end on the last part, but I've used it with like the finances and financially, and also just like statistics and what are we doing well and what could we do better and where is it, like by putting in kind of the stat sheet from the end of the month, just kind of analyzing like where we're doing well, where we can improve a little bit, and what to work on for the next month. And then it can extract some of that, and I can take it with a grain of salt, look at it, and sometimes it can help you look at different statistics you weren't actually looking at before to help people get better. Because a lot of times we just, this is our negative ego, is we just think we're really doing better in certain aspects than we are. And sometimes
Right.
we also think we're doing a lot worse in other areas that we're actually doing pretty well. So having some of the objective data to push things forward is actually really helpful. So
Yeah.
then we don't make up these emotional stories that kind of derail us from progress. So I found it pretty helpful there, because you can always find wins, right, based on whatever you're doing. If you're measuring
Right.
anything, you can always find areas where you're doing better than you thought you were. And that's true in health too. If somebody's like working their plan to get more fit after a month, and it's only been a month, so it's like, how much has changed? Well, if you can measure a few aspects of that, well, compared to last month, you worked out once. Now you did like
Right.
25 days. So just that is a win. You should be proud, right? Like
Right.
you have this data that tracked, and oh, you did increase some of your strength along the way. Um, and you started paying attention to what you're eating. So like when you can have this a tool to break down where you're doing well and where you can improve, it does allow you to see more clearly, so we can be more efficient, because you can ask a lot of questions with AI. And
Yeah.
right, as Kabbalists, we learn to ask a lot of questions, because when you ask questions, you get answers, and
Mm.
they help you see where you are, right? They help
Mhm.
provide this reference point. So I think AI, when used intelligently and in a disciplined way, we can really get better reference points of where we are, so we know where we can change to grow and go.
Yeah. And I think it's ultimately going to create so many different breakthroughs. And there's aspects of healthcare that are just super complex. Like you look
Hmm.
at things like genetic disorders in the human genome, like that is
Yeah.
so complicated. And I think one of the reasons that there's still so many different challenges there is because of the level of complexity. But
Hmm.
we're going to have breakthroughs in all sorts of different types of genetic disorders. It's probably already
Hmm.
starting, but
Yeah.
certainly within the next 3 years. And people, who have these different conditions, I think are going to be able to get a ton of different options and treatments and relief. And also things like surgery.
Mm.
Already there's surgeries becoming more advanced. Like I know
Hmm.
the company Neuralink, which is allowing people who are like quadriplegics to be able to move like a mouse with their mind.
Mm. It's amazing.
Yeah, so people can communicate. They can engage with the computer. It opens up a whole world for them. But in order to do this surgery, because the surgery was so nuanced and microscopic, essentially, they had to
Hmm.
train AI robots to actually do the surgery because it was too microscopic for humans.
Hmm.
So even these things like this advancement in terms of fields like surgery are going to be absolutely massive. Things like cancer
Hmm.
research, all these different pieces. Because when you look at human health, there's certain areas where generally people kind of break down.
Hmm.
Cancer is a big one. It's one of the top killers. Heart
Hmm.
disease, but we're gonna have completely different options for treatment for these. And
Yeah.
I think that the overall like life of humans, like I think it's very realistic for you and I to live to be 150 years old,
Mm.
based on our current level of we're both approximately 40 years old. We're in good health. But with the advances that are coming out in terms of healthcare, I think you're really going to see that. For somebody who's 10 years old now, they're probably going to have a higher lifespan.
It's crazy. Yeah.
Yeah.
Yeah. I hope it continues in that direction. I feel like this is a topic that, because of the rapid nature of evolution, I was going to say, oh, we'll probably revisit like healthcare and AI in like a year and see where we are. But probably in 6 months, we can even, look back to this episode and look at the future. That would be a good check-in, like come the new year, and be like, what's going on this year in AI with healthcare? And maybe even find some people who are kind of leading that charge and interview them, and experts who are really starting to utilize this type of technology for in a positive way in healthcare. That would be a good avenue for us to explore as we continue to, evolve. This is called the Evolving Practice podcast. So we want to check on the evolution of AI, because it's a topic that's not going to go away for sure.
Yeah. And if you know anybody who would be a good person for us to interview, please let us know and connect us, because we are always looking to have more conversations. There's limitations to, everybody has different viewpoints and different experiences and different perspectives. So bring in these people who have totally different viewpoints and perspectives can be so great.
Yeah. Well, we're excited to grow. And if you have those recommendations, get in touch. You can comment on any of our things via social media, on YouTube or on Instagram at the Evolving Practice Pod. And we'd be happy to kind of check them out and do some more interviews. So thanks for being here and evolving with us. And we look forward to speaking with you on the next episode.
Have a great day.